Welcome, you are watching Metropole Business Center here on Metropole TV with me, Fred Makori. Now, we are joined by Dr. Njoki Fernandes, who's the CEO of Kenya Medical Association, and we are going to look at the situation of vaccination in Kenya and where we are as far as COVID-19 is concerned. Is it time to reopen the economy fully? We'll start immediately by looking at how we are doing as far as inoculating the population is concerned. Daktari, karibu sana, and thank you for making time to speak to us.
Good morning, and thank you for having me.
All right, so let's just dive straight into it. The numbers as of yesterday were showing that about 10% have at least gotten the first dose, and 3.3% of the population that is 18 years and above have been fully inoculated. Now, the government intends to inoculate fully the population that is 18 years and above by June 2022. Is that a mirage, or there is a reality, practical reality in that ambition?
Well, I think we need to, first of all, commend the government for the effort that they have put in to try and make sure that people are getting vaccinated. And as far as I know, we have actually more vaccines than people willing to get vaccinated at the moment. And we can see the government has tried to secure all the vaccines. So we have Moderna, we have Pfizer came yesterday. Some doses of Pfizer came yesterday, and we have Johnson & Johnson, and then we have AstraZeneca. So I think the government has really tried to make sure that the population get vaccinated. Obviously, there are two things to think about. One is that the vaccines are a challenge globally, because all the countries in the world are scrambling to get vaccinated. So there is that global challenge of logistics. And then also there's the whole idea of the cost, because it comes at a cost. We're very lucky that the government has managed to get donations, but we are also looking for the fact that I know that they're going to end up having to purchase some of these vaccines, because I don't think the donations will be enough. But it is a reality that can be achieved if we all pull together, that the government continues providing the vaccines, but then that the people also show up and get vaccinated. Initially, there was a lot of vaccine hesitancy. There was a lot of, there were many stories, there were a lot of fears, a lot of myths. But as 3.3% of the country have been fully vaccinated, that's a decent number. And I don't think we have seen too much to worry about in terms of side effects. So I think more and more people are getting confident, and it's achievable. Absolutely, it is achievable if we use all the strategies. Like I'm seeing now in churches on Sunday, they're having a vaccine drive after the services and after the masses. So people can't say that they were working, because after church you just go and get vaccinated, and that's very nice. So I like the enthusiasm. I like the activity, especially on the government side. And so the population, we have to respond to make sure then that we all get vaccinated.
All right. And you said something about vaccination hesitancy, and I must confess I was one among those people who are a bit hesitant to take up the vaccination. But yeah, I got my first jab. What is, in your opinion and in your professional assessment, what is causing this hesitancy among the public? Because we've seen a lot of people who are saying, you know what, me, I'm not going to take that jab onto my body. What is this that is causing this hesitancy?
Okay, initially, of course, there was a lot of fear, because there was a lot of unknown. There were many things about this vaccine that were not known, and that would explain the hesitancy. But with time, I think you guys are the ones who have, we were the guinea pigs, because we were the ones who were vaccinated first, and we didn't drop dead, we didn't grow an extra head. I don't know people are fearing, but the vaccines are safe, and many of the people who have been vaccinated do not have side effects that are alarming. Also, globally, we've seen that half the world actually has been vaccinated. They've issued more than, I don't know how many billion doses globally. So I think people need now to get more and more confident that these vaccines are safe. And you look at the risk of the side effects of the vaccine vis-a-vis the risk of getting COVID and actually getting into ICU and dying. The benefit definitely outweighs outweighs the risk. Of course, there was also a lot of rumor mongering, and unfortunately, a lot of it also came from the medical profession because we were also not informed. But that has since changed, and so I think the people now are really ready to accept the vaccines, and we should tell them they are safe and they can go and get vaccinated.
All right. I know the government is stepping up the effort of ensuring that the vaccine is accessible to as many people as possible in the convenient way as possible. I mean, you don't have to travel for long distances. You can get it in the church. You can get it in the clinic next door. But also, there's that we need to also have these people who are still having this negative perception towards the vaccination sort of begin to change that perception. Is this happening? Is the government doing enough? I mean, all of us who are stakeholders, are we doing enough to ensure that this perception against, the negative perception against vaccination is being elevated and people are willing and coming out to take the vaccination?
I think time has really helped, but then also you realize that globally, there are some things that are forcing us to actually get vaccinated. So, for example, if you have to travel, more and more airlines and more countries are insisting on a vaccine certificate. So, I mean, and I'm just thinking about things like yellow fever. If you've traveled internationally, when you need a yellow fever vaccine, I mean, you need a certificate, and we're not discussing. None of us ever went to complain and say the vaccine is not safe. And we just went and got the vaccine and got on the plane and went wherever we were going. So, in the same way, this is going to become the new norm. And then I think also, even in certain meetings, I'm observing more and more, if you have to attend a certain meeting or if you have to attend a certain gathering, they're insisting that you have to be fully vaccinated. I think this is the way to go. And I think also, like you mentioned earlier, we're in election mode 2022, people, there's election fever already hitting us. I think these platforms where people are meeting are excellent platforms for the politicians to rally vaccination. So if I'm going to a public gathering, I don't know whether they've been allowed or not, but anyway, beside the point, that when you go for that gathering, as you're talking to the people, you've brought MOH guys, so people are getting vaccinated
Yeah.
as you're addressing them. You see, that is a way that politicians can actually use to drive these vaccine numbers up. Because if you come to my rally, make sure you're vaccinated. Eventually, it will be a requirement that people have a vaccine certificate. That's the only way to compel people to get this, because we need a certain critical number of um, population who are vaccinated, and those who have already been infected, to get a certain critical amount of immunity. And we want that COVID becomes like a common cold. Yeah, so it's one of those things that you acquire and you move on with life. It's no longer going to be critical, but we all have to collaborate in this effort.
All right. I'm happy that you brought up the political space that we are getting into as a country. Actually, like we were speaking earlier, you mentioned that we in this space where the political gears have been engaged and politicians are out full throttle trying to woo Kenyans to vote for them. And you mentioned where this would be a good platform for politicians to rally the followers to go get inoculated. But let's talk about the electioneering period. What does that mean to the vaccination drive? Is it something that would hamper, slow down, or is something that actually could work to the benefit of the drive that to get the target that we need to get as far as the population that is inoculated is concerned?
I think if the politicians are intentional, they can actually use those political gatherings as ways of getting people vaccinated. The same way when they come, they give mosquito nets to women. I don't know, they give whatever to children. In the same way, they can say, "We come, the Mchanjo people, please get vaccinated," even as we are discussing our political agenda. And I'm concerned because when I watch these political rallies, of course, the level of caution actually drops. You see, obviously, you can't scream and heckle when you're wearing a mask. So the masks are off. And then this is a crowd, so these people are together. So my fear is that if we don't vaccinate the masses now, as the political temperature continues to rise, we're going to see a natural increase in infection. And this could be disastrous. So it is actually to our advantage. If we want a safe electioneering period, we want a period where people can go and really do their campaigns and everything. We need to make sure that a large population get vaccinated, because then we're going to be dealing with campaigns and we're going to be dealing with a pandemic at the same time, which is not a good space to be.
All right. And staying there on the political electioneering period, and I know you've mentioned that, at that point, the temperatures rise, the guards drop. I know whether it's been allowed or it's people are just going on in defiance or to the regulations. We have been seeing in the past month, the numbers, the positivity rate has been single digits. Is it time now to say that, okay, we're here, we've sort of managed to restrict it a bit? Can we now consider reopening the economy fully? I mean, considering the fact that, yes, a lot of these things have been happening anyway, and at least we've tried to manage the numbers below 10% on positivity rate. Is it time to fully reopen the economy?
Well, that's not my call to make, because there are those who make those decisions looking at very many parameters. But just looking at the trend of COVID over since last year, March, when we started, we've just finished riding the fourth wave. And the pattern is the same. We struggle, it gets to the top, then we get into serious containment measures, it comes down, and then we relax again, and then the wave goes up again. And looking at the current situation that we are looking at now, I don't want to be a prophet of doom, but the fifth wave is loading. Yeah. Why? Because we're only 3% of the population fully vaccinated, and we are in full election mode, and we had actually not careful. So you see, we cannot expect that it's going to be any different. So the same pattern, the same narrative, and very soon we're going to see, in the next 2 months, if we're not careful, we're going to be in the middle of the fifth wave. So we really have to be responsible. And I'm calling on the political people. The same way you get youths to mobilize people to come for your rallies, the same way you get women to you mobilize them and give them lessons and I don't know whatever, mobilize people to go and get vaccinated. Mobilize your constituents, mobilize the people you want to meet, so that in your area you're dealing with positive things. You're not attending funerals. You're not fundraising for hospital bills. And that is what is going to happen. So I'm really calling upon all these people who want to have political gatherings, let it be your agenda. Let it be the push to the government asking where are the vaccines. Our people are ready to be vaccinated. Because we cannot stop electioneering. We cannot stop the country from moving on, but we also don't want to have to deal with the burden of of illness. And the fourth wave was particularly difficult. We really lost very many people. It was quite a tough time, and we can't afford another fourth wave. It was just emotionally, physically, financially difficult. So we really need to be practical. And the leaders, the ones who know these things, are the ones who need to be intentional and rally in your campaign. Have medical people. We can organize a KMA. Come and talk to us. We will give you a medical team in your political rally to make sure that even as you're doing your thing, your people are vaccinated, and that will help, kill two birds with one stone, I think.
All right, and that's a rally to the politicians, but what about the public? Because the public, we are the people who come to these rallies. I mean, we've had the CS over and over again saying, if you refuse to go to the rallies, the politicians will not have anyone to address. So, I mean, yes, to some extent, we want the politicians to be responsible, but what can we say to these people who keep on attending these rallies?
We've always had the discussion around personal responsibility, and so each person needs to be personally responsible to make sure that you don't expose yourself unnecessarily to the risk of getting COVID, because ultimately it will be you and your family that will be in trouble when you're in that ICU bed by yourself. Yeah. So we are urging the public to really make sure that you just attend those public gatherings that you must. And if you must, make sure then that you follow the protocols. They're the same. Yeah. Make sure you have your mask, social distancing, the hand washing, the sanitizing, if you must. But if you must not, then there are other alternatives. These things are televised on TV. If it's a funeral, it will be almost every funeral nowadays is streamed live, yeah, from the church service to the actual interment, yeah. Graduations are online, everything actually.
And as we come to the tail end of this discussion, I know there's a lot that we can talk about in terms of personal responsibility and, you know, taking the initiative as an individual. Because as you've rightly put it, at the end of the day, it is going to be you and your family who are going to be remaining after you've caught COVID-19. So you have to take it as a personal responsibility to ensure that even as you, if you must attend, then take care of yourself. But then there's something that you had mentioned earlier, and in terms of reopening the economy, you said that yes, we could be in that space whereby we are throwing the caution off the window, and we've just come out of a fourth wave that was really draining in all aspects. And if we continue with the trend that we are continuing with, we might end up into a fifth wave that we do not want to have as a country. So is it your professional opinion as a doctor, looking at the factors, all factors considered, to proceed with caution as far as reducing the restrictions are concerned?
Okay, I don't know which restrictions you're talking about. The curfew, the 4 a.m. curfew, what other
Yes,
restrictions are there?
there's the 10 to 4 a.m. Then there's also the gathering. Of course, we know that
Which no one is observing. You see, we have those to enforce. So,
exactly. Yeah.
again, personal responsibility. Government can only do so much.
All right.
Yeah,
All
they are
right.
stopping these public gatherings for the good of the public, but these are the same people who are then going to have meetings, knowing very well. In fact, some point I thought there was a memo that was issued that I had missed,
Yeah.
lifting the ban of these gatherings because everyone is out there doing their thing. But then you see, then now what do we do?
Yeah.
Again, personal responsibility, because
Yes.
you can only police people so much, and ultimately it's up to each one of us. Yeah, and I can promise you, if we
Sorry, could you take that up again? We lost you at some point.
do not already, if we're not careful, we will be here in the next 1 or 2 months.
All right, Daktari, sorry, we lost you at some point.
Weeks, struggling with another wave. Sorry, I'm saying that if we're not careful, we will be here struggling in another 4 to 6 weeks with another wave, you know.
Yeah.
And this is the time when the numbers are low because we have really managed to behave and to contain it, to really make sure that the numbers do not increase again.
All right. So we've come to the end, but before we do that, 30 seconds for any final remarks that you might have.
So I'd like to urge all Kenyans, number one, prevention is always the best thing. Let us try and prevent ourselves from getting infected. And we know how to do it. Yeah. So social distancing, avoid crowding places. And then also the next thing is let us get vaccinated ourselves and those family members who are eligible. The government is doing all it can. And then we also have private sector initiatives like KEPSA. Through KEPSA, corporates have imported the vaccine for their staff members, which is an excellent initiative. We encourage such initiatives and we encourage that as many people get vaccinated as possible. The third thing, we'd like to encourage the members of the public not to choose. Now that we have choice, people are saying, I don't want Moderna, I want Pfizer, I want Johnson and Johnson. And you wonder, really, the best vaccine is the one in your arm, the one you can get into your arm. So let's not be choosy. Let's go and let's all get vaccinated. And then the politicians, the people who want to go and gather in public places, let's take advantage of that capacity you have to draw people to yourself. Let's take advantage of that capacity to get people vaccinated. The churches are trying. So that when you come to church, you get vaccinated. Can we have vaccinations in political gatherings? Then the last thing is let's think about the whole idea of COVID in our schools. There has been a lot of COVID infection in schools in this fourth wave. Our children were very sick. Yeah. And it was interesting because usually we thought children would be spared, but this Delta variant has showed us that our children are exposed. So let us see how we can protect our children because they get infected and then they come and they infect the adults who are the ones who end up in ICU while the children are okay. So let's see how we can we can look after ourselves and how we can be responsible. And as usual, KMA is always advisable, always available to give advisory and to do whatever is needed to help in that area.
All right. Thank you so much, Daktari, for giving us your time and talking to us. It's been an absolute pleasure listening to you and just getting to hear your opinion and your professional input on the matters vaccination and where we are as a country as far as the COVID-19 situation is concerned. Thank you so much for your time, Daktari.
Thank you. Thank you for having me.
All right. As you've had it, at the end of the day, it boils down to personal responsibility. Remember, health is wealth. You cannot create wealth if you are unhealthy. So take care of yourself. It is your personal responsibility to ensure that you are safe of COVID-19. Get out there, get inoculated, and also just adhere to the guidelines that have been issued by the Ministry of Health. And we all know social distance, wear your mask properly above the nose and covering your nose and your mouth, and also wash your hands, sanitize as much as possible so that you avoid and you're safe. Thank you for keeping us company. We're going to take a short break, but when we come back, a lot more on the other side.